Good afternoon. My name is Dr. David Gillarducci. I'm serving as the Deputy Health Officer here in Santa Cruz County. Thank you for coming here today. The County of Santa Cruz Public Health Division is announcing the second case of COVID-19. On Sunday, March 8th, testing confirmed COVID-19 in a patient who presented with symptoms of coronavirus. The patient previously traveled to Seattle, and public health investigators determined that the individual likely contracted the virus there before returning home on a commercial flight. The Santa Cruz County Public Health Department is conducting a thorough investigation to identify the potential exposures and to notify contacts. The patient is now in isolation and recovering. Santa Cruz County Public Health is also urging residents to prepare for potential disruption by updating family emergency plans, and has issued updated social distancing and workplace guidelines. As Dr. Gail Newell, our county health officer, says, unfortunately, this new case confirms that COVID-19 is present in our community, and this is not an isolated case. I urge all community members to take steps to protect themselves and their families. A prior case involving a passenger from the Grand Princess cruise ship which visited Mexico is still under investigation and observation. As commercial COVID-19 testing becomes more widely available, probably next week, it is anticipated that the number of confirmed cases will likely increase, and residents should prepare themselves for cases confirming community spread. While COVID-19 is non-lethal for the vast majority of patients, and many do not require medical oversight, the disease does pose a serious risk for medically vulnerable individuals, particularly those over 60 years old and people with certain pre-existing medical conditions. On March 4th, the Santa Cruz County Public Health Officer declared a local health emergency, and the county has activated its Emergency Operations Center to bolster response efforts. The county will reevaluate increasing response efforts as the situation warrants. Symptoms of COVID-19 include fever, cough, shortness of breath, and may appear in as few as 2 or up to 14 days after exposure. If you have symptoms of COVID-19, contact your primary care physician's office, especially if you have recently traveled to areas with a COVID-19 outbreak or have had contact with a known case of COVID-19. Before seeking medical attention, call first to prevent possible transmission in the healthcare setting. We strongly urge community members to take precautions to help prevent the spread of illness. This includes washing hands frequently with soap and water for at least 20 seconds. Use at least a 60% alcohol-based hand sanitizer if soap and water are not available. Cough or sneeze into your elbow, not your hand, or use a tissue and discard. Avoid shaking hands. Don't touch your face with unwashed hands. Regularly clean surface touched by people using normal household cleaners. Stay home from work or school if you are sick, and get a flu shot to protect yourself from the flu, which has symptoms that are very similar to COVID-19. We also ask that you prepare for the possible disruption caused by an outbreak. Preparedness actions include: make sure your emergency preparedness kit is up to date, stock additional supplies if possible, visit ready.gov for an emergency supply list and other preparedness materials. Obtain 2 to 3 months of your supply of your critical prescriptions. Stock up on essential medication for all family members. Prepare to work from home if possible. Prepare a child care plan if you or a caregiver are sick. Make arrangements to manage a school dismissal of at least 2 weeks, and plan for how you can care for a sick family member without getting sick yourself. Take care of each other and check in by phone with friends, family, and neighbors that are vulnerable to serious illness or death if they get COVID-19. Keep common spaces clean to help maintain a healthy environment for you and others. Frequently touched surfaces should be cleaned regularly with disinfecting sprays, wipes, or common household products. Our community may need volunteers. Think now about the skills that you have and how you can help your community. It's normal to feel some distress during this time about this impact of COVID-19 on our community. Please rest assured that the County of Santa Cruz Health Services Agency, along with our governmental and private partners, are working diligently to respond appropriately. We will keep you informed as new information as it develops. And for local information, residents can visit www.santacruzhealth.org/coronavirus. Call 211 or text coronavirus to 211211. Messaging rates may apply. Thank you.
Thank you, Dr. Deladucci. I'm the Health Services Agency Director for County of Santa Cruz. And the one thing that I wanted to add to Dr. Deladucci's message is that we as a public health division have issued interim guidance for our community so that we can ensure that we mitigate the spread of COVID-19. So up until this point, we had held on to our plans for something called social distancing, and I can explain what that means in a moment. But right now, we have released guidance to the general public called interim guidance on social distancing, and we've also released interim guidance for workplaces. So we are asking that all community members, every individual organization, every family and community familiarize themselves with these guidelines. They are available at the website that Dr. Deladucci mentioned. And on that website and within that guidance are also links directly to California Department of Public Health and the U.S. Centers for Disease Control and Prevention. I want to remind everybody that something that I said before, that our local health division is our local health department. And we are part of a system of local, state, and federal public health. And we work in lockstep with the state and also in lockstep with the CDC in everything that we do. So you may find when you look at these social distancing measures that they're difficult. They are. They're challenging. They're going to disrupt our daily lives. They will disrupt business. They will disrupt school. I know that they are severe, but they are the same actions that other communities with what we have defined as potential community spread have taken, including Santa Clara County, San Francisco, and Seattle, Washington. Our goal is to slow the disease trajectory, and we know that the disease needs people to spread. So if we lessen the amount of time people spend amongst each other and the number of people together at one time, what we can do is slow the disease curve in our community, and that gives our health system, our public health system, our schools, everybody time to not have experienced surge in the care system. If anyone has immediate concerns and questions, I advise this is the time, I've said this before as well, this is time for every individual family, organization, and community to be prepared. That includes the faith community. So learn as much as you can. Go to all of the websites. The guidance at the state was developed at the local level. They have involved all of the county health jurisdictions in developing their school, workplace, long-term care facility guidance. And everything that you need to know is there. Again, the County Department Operations Center in the Public Health Division has opened. That is available for medical and health resources, and the County Emergency Operations Center has opened as well. And those are for resource planning or other requests beyond medical and health. And we'll open it up for questions now.
So in this case, how long has the person been back from Seattle?
I don't have that timeline in front of me. Do you happen to know offhand?
I believe it was the end of February. I'm going to defer, we do have our Chief of Public Health here from Communicable Disease Unit.
It was end of February, and we've been monitoring them as soon as it was reported to us.
Yeah.
Yep.
So they've been home from for quite some time, but my understanding is they developed their illness while in Seattle and came home on a commercial flight. So when they returned, they were ill. In a way, what that means is they sought care immediately. And so hopefully this person has been generally at home and resting because they have been ill. But I can say that our communicable disease unit, as soon as they were alerted of the case, has been monitoring and doing a case contact investigation.
And how does that process work exactly, the case contact investigation?
It's investigating and finding out all of the contacts that they've had, following up with each one of those, finding out, it's like a giant matrix of of tracking down contacts and then asking people who have been exposed to monitor themselves, report to the health department twice daily, those kinds of things.
Is that person a female, a male, the age? What do we know about that person?
We're not releasing any information beyond what's included in the press release.
Well, I have a question about that. I mean, I understand, I don't think any of us were gonna ask any further questions about the actual people, but the locations where they live, why is that not being released? It seems like that's fairly important information for the community to have.
That is not information that we have, in consultation with healthcare privacy laws and everything, that's, at this time, not information that we are comfortable releasing. That's why we have case contact investigations, so that we can understand where this person has been, whom they've interacted with, what hospital or healthcare system they may have visited. And that's the other reason that we do social distancing. So we know this is in our community. And the other thing I want to say is we won't be surprised if we have more cases. We expect that we'll, just like the other counties, that this is just the beginning and we'll have more cases. So again, the whole point of social distancing, saying if there's a positive case in a school, we may advise that the school be closed down. It's not because there's such an imminent threat or danger to either the school children or the parents. What we're really trying to do is slow transmission. I want to emphasize, as many of you know, this is more serious for our older citizens. So if you're 60 or older, or if you have diseases that affect your organs, like your kidneys, heart disease, COPD, it's really, really serious. So until there's a vaccine available, it's incredibly important that all of us do what we can as individual citizens to stay home, to not go out unnecessarily, so that we can be a part of slowing that transmission. I remember, I think it was back in the early 2000s, California had a pertussis outbreak. 9 infants under 6 months old died. And it was unnecessary. And it was because our vaccination rates had gone low, and those infants are too young to be vaccinated. So if all of us had done our job and just gotten vaccinated or not gone to work when we were sick, we could have prevented those infant deaths. Now it's the flip side. It's our older citizens that we really have to look out for.
Can you tell us how many people you are monitoring? We have 2 cases. One was the ship, and one is this plane, the jet. So
Yeah.
can you tell us how many people you are monitoring at this point?
We're not talking about the number of persons that are under monitoring or investigation, but we do know that we have additional people that we are following from the Princess Cruise, Grand Princess Cruise.
And this jet, or this commercial flight? Same thing?
At this time, we don't have persons that we're monitoring, but we may, because we've just started, we only just found out about this, so we've just started our case contact investigation.
Are you investigating any type of community interaction here in town where someone may have transmitted the disease? Has anyone?
So there have been lots of rumors and lots of reports of I have been exposed to COVID-19 or I believe I'm sick, and we have spent a lot of energy following up on those, and what we find is oftentimes the fears come because they were in the vicinity of someone who tested positive, or they were near a healthcare facility where someone had presented for testing or was sick. So none of those are risks. You really have to have, think about catching a cold or a flu. You've got to have some kind of interaction. One of the things that is in the workplace and the social distancing guidance is to clean commonly touched surfaces, because if people cough or sneeze in their hands, touch a doorknob, touch a counter surface, slide their hand down a railing, viruses can live for quite some time on those surfaces, so just be clean.
There was another rumor that was spreading on social media regarding the mall. Have you checked into that? Can you give us any reassurance that there's nothing to that rumor, or are you still looking into it, or are you familiar with that?
I'm not familiar with that, but there are many others. So what I can say is we're scientists and we're epidemiologists. So what we do is we don't go and pursue every community rumor. When we have a legitimate reason, scientific reason based on data and evidence that it's in our community, otherwise we'd be spinning our wheels following every kind of community rumor. So I just urge the public, if you think it might be in the mall, maybe it is. We really don't know. So if you choose to go to the mall, you really have to go to the mall, keep to yourself, wash your hands, especially after going to the bathroom or before eating and after eating. those are the most important things that people can do to protect themselves and their families and their community, are the personal things that they're in control of to stop the spread of this disease.
There's also been, you're talking about meetings and the like. Tomorrow, there's a County Board of Supervisors meeting. What are you suggesting or recommending to the board? Do they carry on with this meeting? Or is it going to be like only a handful of people at a time being allowed in for the item in question?
Yeah.
I can handle that a little bit. So we are making accommodations due to the new guidelines that do apply to the whole community on large gatherings. So we are opening up the basement community room. That will be simulcast. You can still go to the main room, but if there are a lot of people in there, that makes you uncomfortable. Go to the basement room. You can submit comments and watch the board meeting live in the basement room. We're also opening up live comments so you can watch it from home on your computer as well, and you can submit live comments that will be read into the record during the board meeting. So we are making accommodations for the board meeting.
Has the status of the first case changed?
No, it hasn't changed. We're continuing to monitor. As far as we know, at this point, the health of that individual is fine, but it's closely watched.
If you do contract COVID-19, can you get it again? If you know what I mean, if you come in, so you can.
We don't really know if it confers immunity. Certainly, some may get confused, but the coronavirus, there are 4 different coronaviruses that are very common that cause the common cold. And we know it's possible to catch the common cold every year. It could be one of those viruses or another that comes back. But we don't know enough yet to know if a single exposure or infection of the COVID-19 confers immunity going forward.
Now, there's a lot of talk about test kits and everything. Are we going to see any test kits soon here in Santa Cruz County?
Yeah, there will be more testing coming. It's still a process, and it may be another week before that happens. We expect, as we said before, we expect that as the availability of testing increases, so will the prevalence of cases, the number of cases that we detect in the community. We fully expect that to happen.
How
So
difficult?
I'd
go ahead.
like to add something
Yeah.
about the testing. So there are 2 venues of testing available. So we have the capability to test right now, but because we're part of the public health system, the government public health system, all of our tests have to go to a CDC-approved lab. So right now, we're using Santa Clara County and Monterey County. We could also send to the state lab in Richmond if they were overwhelmed, and then the CDC. The other testing that Dr. Gillarducci is talking about that'll be available next week is private lab testing. So they anticipate for large capabilities in private lab testing to happen. I think the date, I hate to put out dates because they could change, but the date we were given was March 16th, that clinics could start using the private tests. And so for now, because they're not using the FDA approved tests, if you have a test from a private lab, then it comes back positive, we call that a presumptive positive, we still have to go through the CDC process.
How
But
difficult?
that'll likely change in a week or so, or whenever that gets
We hope
approved,
so.
right?
We hope
Okay.
that those private tests will also get FDA clearance, but my guess is what's gonna happen is it's the data that's important. We're gonna start understanding how this disease is behaving in our communities, and that'll inform us about our next steps.
The 2 people diagnosed were isolated here locally in Santa Cruz County. They're isolated. What's the?
Yeah, they are isolated, self-isolation. We're minimizing contact with other people so that we control the spread.
How difficult is it to go through the diagnosis process?
It's not difficult. It's a nasal swab and an oral swab, and the test itself is about a 48-hour turnaround. We expect that becomes faster, and it's because sometimes the clinicians need that information to make treatment decisions and admission decisions.
In the social distancing guidelines, is there anything about transportation or leaving the county, things like that you guys are recommending?
Yeah,
Go ahead, feel free.
so there are a lot of different things. In terms of public transportation, we're asking that transit and commercial transit providers ensure that if it's a station, ensure that there's hand washing and hygiene supplies. And whether it's public or private, if you're a Lyft or an Uber driver, just make sure you have tissues and hand sanitizer available. And just like any other business, there are recommendations to regularly wipe down commonly touched surfaces like the door handles or the armrests, things like that.
Any possible school closures?
There is a possibility, so I encourage the public to read the school guidance, guidelines distributed by California Department of Public Health. And I may have mentioned it before, but the guidelines that Santa Cruz County is going to follow, that follow suit with the rest of the Bay Area, is that if we have one confirmed case in a school, we're going to recommend school closure. Of course, whether schools actually close will be up to the district.
Is there a possibility that local events will be canceled, like a concert or a chamber event?
Yeah, it's actually so I want to talk about time frame. So now that we know that we have this potential community spread of the disease in our community, we're looking at that disease transmissibility window of 14 days. So these social distancing and workplace guidelines are only in place for 14 days until we have a better handle on what's happening in our community. And so during that time, we are asking that our guidance is, again, if you want the whole community to do its part in limiting the spread, concerts, large gatherings, anything over like 50 people that are going to be really close to each other for more than a couple of hours, really think about modifying, postponing, or canceling it. I've already gotten a number of calls from people who are having meetings or conferences, and some of them have already altered them to have virtual options or change the seating arrangements, shorten the length of time. So there are a number of things that people can do to just lengthen how close people are to each other and how long they're with each other. Finally, don't go anywhere if you're sick. Really, if you're the 60 and over and you have health conditions, just stay home. See if you can have neighbors, loved ones, other people help you with your daily activities and everything. But it really is important that if you're sick, you stay home.
I know you talked about community meetings and the like, but and concerts. What about restaurants? I hate to throw that out there too. Is that something you consider as well? Serving food and
Serving food in and of itself does not impart a higher risk. It's more about, general hygiene in the restaurant itself. The most important thing is obviously washing your hands before you eat. That is probably going to do the most in terms of preventing spread.
Use an example in a restaurant setting. You're typically not shoulder to shoulder for 2 hours with people that you don't know. You're sitting in tables, you're fairly spread apart. And as Dr. Ghilarducci said, so the transmission is coughs and sneezes, so you think about how it's transmitted to think about settings.
We'll do one or two more questions. Do you have anything else? No?
What are some of the underlying conditions that these people, older individuals, have that make them susceptible?
So I'll let you answer.
Oh, sure, yeah. Well, any infection does add added stress to the body. So if you have a pre-existing condition like diabetes, which can impair your immune system, or congestive heart failure, which means that your heart doesn't pump as efficiently as it should, those conditions can kind of exacerbate or multiply on the infection itself. So it limits the body's ability to handle that added stress.
Anything?
And then, is it back in?
One more?
Go ahead. Sure.
Yep.
Thank you.
Yeah.
Do you have any kind of outreach to people in Santa Cruz County who are homeless?
Yeah, well, we do have a couple of mechanisms. One of which is our homeless persons healthcare project, and they have an ongoing relationship with many of our persons experiencing homelessness here in Santa Cruz. We will probably have to do additional outreach through EMS, the Emergency Medical Services as well, and there'll be some messaging through our healthcare facilities too.
do you plan on putting out any sort of hand washers or any additional types of hygiene type of machinery or whatever out there for them?
I don't know offhand.
Yeah, those are all parts of why we have the DOC and the EOC open. And so we are working on all of those things. And I will say that outside of healthcare for the homeless, there are a number, and we have been working through our CEO's office as well as our healthcare partner system to work with them as well.
How
Thank
can
you.
you do the social distancing in the shelters when people are piled in there?
So part of our preliminary plans for the homeless population is you know, people become symptomatic. So if we had a presumptive person under investigation in a homeless shelter, our public health division communicable disease unit would come in and we would immediately isolate that person. We've talked about having hoteling. We've done this in other public health emergencies where that person needs to be isolated or quarantined for 14 days. We would do that, and we'd have the ability to have a public health nurse check on them. The other thing that we're exploring is, and have also come to the table to say we can help in this respect is, so isolation is for sick people, quarantine is for well people that might have been exposed, finding places apart from shelters where people who need to be quarantined, asymptomatic well people, but we're waiting that 14 days. So we're working on all of those things.
Thank you. If you have anything else, just follow up individually.
Interesting.
Okay, that's a new topic.
Dr. what's your time?